Hello, good evening, everybody. My name is Dr. Tamara McCants, and this is Pharmacy for the People. I'm so excited to be joining you all tonight, and thank you all for joining me for your quick little tidbit of health information in language that you can understand so that we can start the discussion and continue the conversation about making our community better. So today I'm going to discuss a topic that's very near and dear to me, which is HIV and AIDS. February 7th is National Black HIV AIDS Awareness Day. And what I want to do today is just have a real conversation about how HIV is affecting the Black community and remind us how HIV is indeed still a pandemic. And so by the time we are done with the conversation tonight, I'm going to give you some real tips for us to have real conversation with each other so that we can prevent the spread of HIV and AIDS in the Black community. So first, let me just discuss what exactly is a pandemic. We tossed the word around, ever since COVID, we know everything is a pandemic, but what a pandemic really means is that it's something that is occurring globally. It is a disease that is prevalent all over the world or in one country. So it's like a big region that is being effective, as opposed to an epidemic, where epidemic is usually like just in a city or like a locality or something smaller. But because we're just more global as a community now, everything is quickly turns into a pandemic because we are able to travel and go coast to coast and, from continent to continent way easier than we ever were before. So first thing I want us to really understand is that HIV AIDS is a pandemic. There's other pandemics going on other than COVID. The opioid crisis or opioid abuse is a pandemic or is an epidemic still. So we have so many other health issues that we can be talking about. And so I'm glad that we're taking the time to talk about HIV and AIDS today. So just a little statistic. In 2020, Black Americans represented only 12% of the U.S. population. And I think that's an important number for us to know in lieu of the political discussions of Joe Biden's pick for a Black female Supreme Court justice. But we're not going to talk about that tonight. I'm just putting that bug out there. Black Americans make up 12% of the population. But we make up 43% of all new HIV diagnoses. And we make up 40% of people living with HIV and AIDS. That is a huge number. Currently in the United States, there's 1.2 million people living with HIV and AIDS. So that means about 500,000 of the people living with HIV and AIDS as Black people. And so, I don't know if you guys remember back in 2012 when Hillary Clinton, when she was a Secretary of State, was talking about how, we're going to end the HIV epidemic, or, they were feeling like, we kind of had it under control. But it wasn't under control, or we weren't seeing that same type of movement in the Black community. And it's because we're so conservative. We are the most conservative people that we know. We don't talk about sex openly. Sex is still taboo. We're all still acting like we're not having sex before marriage. We're not talking about protected sex and unprotected sex. We're not talking about people that we know that's shooting heroin. We know we're so educated and we are so wealthy and we're doing the most and going to clubs and everything, but meanwhile your cousin is still getting high shooting heroin, and you're not talking to her or him about HIV and AIDS because we just think that we're too good for that. But us feeling like we're too good for that is making us die, and it's making us sick, just like it is with all the other disease states. So I'm not here to just talk about the problems, though. So we are going to discuss the solutions as to how we decrease the spread of HIV in the Black community. And the best way is through all addressing all health disparities is through making sure that we have open and honest conversation. And for all my fellow healthcare professionals out there, I want us to start with us. You see that young Black girl coming into your pharmacy, coming in for 2,000 milligrams of metronidazole. You know what? She's treating a sexually transmitted disease. Do you have the guts to say to her, hey, have you gotten tested for HIV and AIDS? Have you gotten tested for HIV? Because if we don't have the conversations with our community, then who will? And men having sex with men, especially our young Black men having sex with men, they are the ones that are still disproportionately dying from HIV and AIDS. And are we talking to them? We know that, you know that your cousin is gay, and you know that your cousin is gay and out here reckless. Are you having a conversation with him? No, because in the Black community, we don't even want to talk about the fact that people are gay and that people are in same-sex relationships. And we need to stop it, because if we don't, we're going to continue to die. So I want to clarify a couple of things. So if I'm encouraging you to want to do something about it, that you at least know exactly what you're talking about. So HIV, what is it exactly? HIV stands for human immunodeficiency virus. And it's a virus that attacks the body's immune system. Here we go, talking about the immune system again. Without your immune system, you can't fight off any disease. You can't fight off any bacteria. And HIV is not the same as AIDS. HIV is the virus that causes AIDS. But AIDS is a clinical diagnosis based on the amount of T cells, a specific cells that's in your body that helps to protect your immune system. So HIV is not the same thing as AIDS. So there's no cure. There is no cure currently for HIV, but it can definitely be controlled. And if you're like me and you've been in practice for about 20 years, you saw when HIV was running rampant in the community. You saw when people were experiencing a rapid weight loss, and HIV was truly a death sentence. But it's not like that anymore. There are so many efficient treatments out there for HIV that if you just know about it, that you can access it, that if you are HIV positive, and I'm talking to you today, that if you are HIV positive, you can live a long life with medications that are available, simple medications that are available. And I want to encourage you to take your treatment and to make sure that you are treated, because the medicine works. It's not a death sentence. Don't let the stigma keep you from treating yourself, because that's what we're really afraid of. And that's what's really killing us, is the stigma. So how do you know if you have HIV? HIV is a virus, so it presents the same exact way other viruses do. Cough, fever, chills. With HIV, though, you can see swollen lymph nodes, and you can also see mouth ulcers. Most people experience acute sickness between 2 and 4 weeks after being exposed to HIV. So a lot of times you don't even know what it is, but you may be HIV positive. But what you have to do is to be honest with yourself as to whether or not you have exposed yourself to HIV through certain behaviors. And I'm going to talk about those behaviors right now. because the more we know, the earlier you catch it, the better you can be treated. Once you are diagnosed and you know that you are HIV positive, it is so easy for you to be treated and to live a long, healthy life. So HIV is only transmitted through body fluids, semen, vaginal fluids, anal fluids, breast milk, and blood. So that means that there's only 2 or 3 ways that you can get HIV. One is through unprotected sex and exchange of sexual fluids. Again, anal fluids, vaginal fluids, and vaginal fluids. The second way is through an exchange of blood, which usually occurs when you share needles. So injection drug users that share needles can pass the disease to each other that way. And the last but not least way is mothers transferring it to their babies, either through birth and through breast milk. So for the mothers that are out there, I encourage you to please get prenatal care. If you're pregnant, just get prenatal care. Say yes to the HIV test and find out if you're HIV positive, and go ahead and get treated if you are. If you are out here, and you know that you are engaging in behavior that exposes you to HIV, I just want to encourage you today to not be ashamed of those behaviors to the point where you don't protect yourself. I want you to make an informed decision to know that today, and starting today, I am going to protect myself from HIV, because I am not comfortable with the fact that Black Americans only make up 12% of the population, but 40% of us is living with HIV and AIDS. And even worse, again, 43% of us account for all of the newly diagnosed cases. And that's because we are not protecting ourselves. We are not preventing the spread properly in our communities. And so there's basically 3 main ways for you to prevent the spread of HIV. One, if you are an injection drug user, or if you are getting high, the first thing I want to encourage you to do is to get some help. Figure out, why are you getting high? Access somebody, talk to somebody, and see if there is a way that you can stop using drugs. There is treatment out there for you. But if you know that you're not ready to stop using drugs yet, especially if you're an injection drug user, then make sure that you have clean needles. Don't share your needles with anybody. Have your own needles, clean needles. Pharmacists out there, if someone is coming into your store and asking you for clean needles, do your public health duty and give them those needles, because that's how we stop the spread of HIV. And also, if you are an injection drug user, meaning that you're injecting heroin, then make sure that you have your naloxone with you too, and don't get high by yourself. The second way to prevent HIV is by using condoms during every sexual encounter. Condoms is the only way that consistently protects you from exchanging bodily fluids. And while it's not 100%, it is a great barrier and a great way to protect yourself from HIV and AIDS. And last but not least, I want to talk to us about PrEP. PrEP stands for pre-exposure prophylaxis. So that's medication that is available to people that know that they are engaging in behaviors that expose them to HIV. But if you are on PrEP, then if you are exposed to HIV, then the HIV won't get a chance to take hold and spread in your body. And a lot of people are protecting themselves. A lot of other races, a lot of other people are protecting themselves from the spread of HIV through the use of PrEP. It's a convenient medication, once a day, easily accessible, and it is 90% accurate or 90% effective in preventing the spread of HIV through sex, and about 70% accurate in preventing it through injection drug use. So as we embark upon National Black HIV AIDS Awareness Day on February 7th, I would like to challenge all of you to just do something to acknowledge HIV in our community. Wear a red ribbon, have a conversation with someone about their sexual behaviors and whether or not they are being put at risk. Encourage someone to take their medications if you know that they are HIV positive, or you can donate to your local organization that is doing treatment, prevention, testing for HIV and AIDS. Every single person should get tested for HIV every single year just to make sure that you are not exposed to the virus. But once you know, then it can be treated. So let's just continue to talk about it, and hopefully we can see a decreased impact in our community. Thank you so much for listening tonight.